At first, doctor, what is the premature ejaculation, its reasons, and the latest methods to treat?
At the scientific books, the ejaculation period range is from 2 to 5 minutes, or from 3 to 7 minutes. But practically, it is the ejaculation before the other party reaches the orgasm. It differs though. 27% of women reach the orgasm in less than a minute. In the other part, 90% of women reach it in less than 7 minutes. All the operations for the premature ejaculation depend on cutting or burn the nerve. However, it is temporarily solution, as it does just take about 9 months and the problem will come back again as the nerve is going to grow up and the patient is going to do the operation one more time. Plus, it is very expensive. It costs about $3,500 minimum, and some of the patients may not respond to this operation in some cases though. Some psychiatrists advise to think about anything else during the sex, but that will lose the pleasure. Or they advise to practice Master Johnson's method, which is pressing beneath the penis's head. However, a lot of people recommend it though. Actually, it was the global solution though. However, the patient cannot enjoy the sex with those kind of methods, and after 3 years, it has no effect whatsoever. And in some cases as well, it came back as the point zero. If we went to the medication pills, most of these pills have side effects like drowsiness, increase of the heartbeats, and stomach aches. And in some cases, they don't affect properly. I invented a new operation to solve that problem with my name, and I am using it for 5 years so far. Premature ejaculation has three reasons. Number one, the brain. Number two, the lumbar muscles, and we call it the bulbous pangitis muscle. Number three, the sense receptors. The operations outside, though, solve one reason out of those three reasons. However, we made researches for 5 years to know all the reasons of premature ejaculation. So, at the sexual dreams, at the rapid eye movement, the dream just takes about 6 seconds, and the ejaculation at this dream takes about 0.48 seconds, half a second. So, if the brain is the most controlling part, the ejaculation will happen in half a second almost in all cases. Regarding to the muscle, at the spinal injuries, we diagnose the injury by a simple test. We press on the head of the penis and automatically the bulbous pangitis muscle inside the penis will contract. So, at the sexual process, it is about the same, as the vagina is pressing the penis's head and the ejaculation will happen right away. So, we started to remove both sides of this muscle, and about 60% of patients are fully recovered and satisfied, and this operation works very fine with them. Some of the patients have a very high sensitive rate at the skin of the penis, and using creams and sprays at the penis's head is useless. That is because the frontal delta area is the most sensitive area at the penis, not the head of the penis. And it is like the G spot at women. And by removing this area, the ejaculation period is going to be improved very well. We started to merge between the last two operations and found out the successful rate reached up to 97% of patients. However, though, the other 3% of patients have the brain control over the sexual process. Mostly they are treated by medication without any results. So, we did this operation and let them use the medications but with less doses though, and it worked very well with them as well. And now we started to perform the operation on the normal people as well upon their request to improve the duration of sex. The response after the operation comes in two ways. The patients without any sort of nervous tension, they respond in one jump from 10 minutes to 20 to 30 minutes. And with the patients with nervous tension, it comes gradually through 3 months. In the first month, it becomes from 5 minutes to 8 minutes, and then 8 minutes to 10 minutes, and so on. However, the amelioration percent is going to be from 200% to 1000%. So, doctor, are there any instructions after the surgery? I just give the patient some antibiotics and painkillers for about 10 days or so, and the patient can definitely practice his daily activities without any problem, like taking a shower, driving a car, and whatsoever. However, the patient cannot carry heavy weights for about the first 5 days of the operation, and definitely cannot practice sex for the first 21 days, and in some cases it takes 16 days only.
So, doctor, in the future, are there any needs to change or do the operation one more time?
Well, it is a permanent solution, and the patient won't do the operation one more time as there is no need to.
Thank you very much, doctor, for giving us hope, and thank you very much for being with us today.